It can spread through the water distribution system. It can also be picked up by flies, which drop it on food, and is then carried by people who spread it from hand to mouth. And if it enters the human body, without intervention, sufferers could die in a matter of hours. It is cholera, caused by bacteria called Vibrio cholerae.
The prominent symptom is a watery, profuse diarrhea. It's just like putting on a tap. The patient loses huge volumes of fluid within a short period of time. Sometimes there could be some slight abdominal cramps, headache, a vague feeling of being unwell, lightheadedness, tiredness. But like I mentioned earlier, the prominent symptom is a profuse watery diarrhea that is described as a rice water or rice water stool. The physical appearance could range from a normal physical appearance to the person looking dehydrated, the eyeballs are sunken, the cheekbones are depressed, the patient is basically dehydrated, there's listlessness, the person feels tired, cannot move around much.
According to the World Health Organization, there are 3 to 5 million cases of cholera worldwide and 100,000 to 120,000 fatalities of the disease every year. In spite of these grave consequences, treatment is simple.
You give oral rehydration solution to the patient before if it now becomes more severe, you now have to take the patient to the hospital. Even if you're going to take the patient to the hospital, you must institute oral rehydration solution therapy. There are some solutions that are already packed. It comes in a sachet, so you just open up and follow the instructions. Usually we get a liter or so of clean water, okay, and constitute the solution.
Hygiene is important for good health, and the availability of clean water cannot be compromised, but not everyone has access to this.
For those who don't have access to potable water, let's say potable water, water could be made safe. And how is this possible? By boiling. That's the simplest method. Okay, that can be done in the household. So water for drinking should be boiled, water for cooking should be boiled also, water for washing utensils should also be boiled. And in addition to that, water can also be treated with chlorine. There's a safe amount of chlorine that can be used to treat water. Food vendors should properly cover their food, properly cover their water, save food when hot. Okay, these are practices that could reduce the transmission of cholera.
There is no substitute for washing one's hands with clean water, and the prevention of cholera requires personal effort, no doubt, but the community and every tier of government have a role to play.
The surest way on a long-term basis is to make sure that water distribution, water filtration are at optimum levels, because this is a waterborne disease. As much as possible, boreholes should be dug. If we must dig boreholes, they should be far from sewage pipes and from sewage systems. They should be far from gutters and pit latrines. And then, of course, you need environmental aspects, what we call EIA, environmental impact assessments, because these things have an impact on the environment.
The first outbreak of cholera was spread from the Ganges, India, in the 19th century. Since then, outbreaks have occurred in several countries, and cholera is now endemic in many nations. A seventh major outbreak started in 1961 and is still on. Mary Alale Yusuf, Channels Television News.